Hey everyone, Dr. Nicholas Beasley here from Wuji Medicine, and today we're going to talk about lower back pain. Lower back pain has become a little bit more common again in the clinic, so I'd like to do a video for all my patients who are suffering from back pain and the different types of back pain, as well as to educate students and some of my apprentices on what I see when we're addressing lower back pain. So lower back pain refers to any pain or perceived pain in the area that surrounds the lumbar spine and the sacral spine, the pelvic area. So there can be quite a few different presentations from acute situations where the pain just come on quite intense and quite sudden to chronic lower back pain. So what we'll do, we'll break it down into two kind of parts. So often when we have an acute issue, such as like you're outside, you're picking something up and your back seizes up and causes like a shooting pain or like a spasming. Usually what happens in this situation is that there is a little bit of a nerve that's being irritated or pressed, a disc that might have pressed on a nerve. So what happens in these situations is a patient might have had poor posture or overworked with poor technique, leaning over. And what happens is the muscles actually start to like seize, tied up a bit. Patient goes over for a few hours and goes to pick something up, and basically the muscles don't quite activate and they cause like a spasming effect. And so what happens in this situation, the nerve that's involved will usually be irritated and inflamed, and depending on what nerve and what branch of the nerve is, depends on what the presentation is. So we have a sciatic nerve that gets impressed, and we get the classic sciatica, which is a sharp pain that comes down, like electrical feeling that goes right down the posterior portion of the leg, down into the heel, and this is like the classic sciatica. And what's usually happening in this situation is either the sciatic nerve has been stimulated and kind of irritated at the lumbar spine, the lumbar sacral spine, these areas here, there's a compression of the nerve there. Or we have a second presentation where the piriformis, which is one of the leg muscles that helps to open up the glutes and externally rotates the leg, that is pressing on the nerve basically around the ischial tuberosity in the butt. And so we get that sensation. Often in the piriformis or piriformis syndrome, the peroneal nerve has a pain which is like an irritating pain that goes down the side of the leg towards the knee. In worst case scenarios, you'll get a little bit of a neuralgic feeling down like the lateral kind of anterior portion of the leg. In Chinese medicine, we refer any form of sciatica and peroneal nerve syndrome or piriformis syndrome, to the Foot Tai Yang Bladder channel. So the treatment is to address that and to unblock that using certain points. Then we have our bulging disc situation. So if a patient has, like I said, gone and exercised too much or gone strained and then gone to sleep at night and gone into a position, they've gone to move, the muscles have not quite contracted to protect the spine, and so then there's an irritation or there's a disc that's kind of slightly moved and presses on the nerve. This can cause a spasming to the muscles, that everything seizes up in an attempt to protect any further damage. Often in these situations, the pain is very intense. The situation is that the patient can't move efficiently. However, in treatment, it's like very, very different. So in treatment, often with these patients, I get them in like nearly every day for a week. And if I see them like every day for a week, every time they come, the pain will drop by 10, 20%, 10, 20%, 10, 20%. After a week of treatment, usually that patient's actually moving again, and now and then we'll need maybe a follow-up or two the following week. After that, the injury rectifies itself. So acute situations can be intense, more in pain, and very restricting, debilitating, but the recovery time is very fast. Okay, that leads us to our second syndrome. So if we're looking at it as like an acute excess pattern, then we think we put them together. Very strong pain, comes on very fast and responds well to treatment, but it takes a few goes to do it. Okay, second one that we have is the chronic lower back pain, which is predominantly pain that's felt deeper in the spine, and it's specifically associated with stiffness, with joint immobility, etc. People who sit down and then they get up, it's a really tight feeling. The pain in this situation is usually around midway, like around about a 5-6. Doesn't really have that sharp catching feeling, but at the same time, it doesn't go away as easy. These people have, when patients come into clinic, usually have had pain for about 5 years or plus. Sometimes you'll get them in 10 years. Now, in this situation, the issue is not necessarily just in the area, in the local area. It's actually associated with the proprioceptive pathway in the midbrain. So they've got a weak proprioceptive pathway. The brain is not getting the right signal to the area to come and heal it. And usually this is to do with stiffness, overworking, poor posture, lifting heavy things. And in this situation, what we have to think about is more the deeper muscles, which include more of the multifidus muscle, the quadratus lumborum. These are deep spinal erecting muscles. So these muscles are about erecting and lifting up the spine from a seated, deeper position. So much deeper than the sciatic nerve and the spasm nerve and the muscles that sit on the superficial aspect of the back. These are the muscles that are closer to the spine. And in this situation, treatments respond really well to acupuncture. We do deep points which target more the kidney vessel, and we use different points across the body, closer to the bone. These patients will come in with a 5 out of 10 pain and often get up and they'll be down to a 1. What will happen is over the next few days, pain will start to come back, we hit it again, we drop it down, we drop it down. Over the course of about 4 to 8 weeks, the pain significantly improves because we're restoring neural function in the midbrain so that the body can send out its natural painkillers and heal really, really well. So that's the first look at that one. We do then have, if situations present, in Chinese medicine we also recognize osteoarthritis, which is a common condition in joints which are immobile or they've got some common restricted blood supply. So in our medicine, we look at osteoarthritis as a cold bizeng. Cold, obviously a restriction, and that it's generally kind of like on the bone, it's not inflammatory. Then we have, along with that, we have a bizeng, which means obstructive syndrome. Often or not, these presentations involve a little bit more work because what we're trying to do is the same thing, but now we're going to try and restore blood flow and as much neural function into that area as possible, but we're trying to break up any blood stasis in that area. These patients react really well to warm, hot heat packs, hot water bottles, herbs which are vasodilating, herbs which are very, very warming and can actually get into the bone. So this is how we work it there. With these patients here, treatment usually takes minimum of 12 weeks, to really have a long result. However, arthritis is not something that comes on very fast, especially in low back pain. It's something that has been worked upon for a while. Stretches, daily massages, stretches are really, really effective and really useful. So I send out some exercises on there. Thinking about the function of the kidney vessel or any of these deep erector spinal muscles is to erect the spine. So obviously the treatment is to contract and to basically elongate the spine down, tucking the chin in and opening up the vertebrae as much as possible. We've had incredible success with low back pain. It's one of the probably more easier things to treat in clinic. Again, with right education and using the right props around it, patients really enjoy the acupuncture, and it's something that acupuncture is really, really recognized. So we do that. Other things that you could use is moxibustion, heat sticks, heat packs, like that, as much as you can. In the situations when you compare it to a spasm, often not people with spasm, you've got to be very, very careful not to overstimulate the points, where with people with chronic low back pain, you can actually give them quite a lot of stimulation because usually they've not got enough stimulation, that's why they're in pain in the first place. So it's really important that we understand from Chinese medicine the deficiency patterns. So deficiency of yang, deficiency of warmth or like excess cold, and then from the excess patterns we know that there is basically like a spasm that's happening and that we have to relax that patient. So in that case, the treatment is actually a little bit more to relax the mind and to calm down the nervous system to allow the healing to happen. So I hope that this video was useful. There's so much more to discuss and explore, so I really enjoy answering these questions and sharing this knowledge with as many people as I can. Just know that the body heals as it needs to heal. And so when I give you these ideas, this is just my general kind of work. Some people heal faster, some people heal slower. But if you are constantly getting a repeated injury, then usually there's an imbalance in the musculoskeletal system, and we rectify that with our Qigong practice, which is very, very effective. So keep looking out for videos. I'll share some more on exercises and breathing patterns and Tai Yin stretches, so that you guys can have a long and healthy, happy spine. Okay, thank you everyone. 谢谢。